A Fair Start for All, Ending Period Poverty for Rural Montana Youth. A policy presentation to the Montana Senate Education and Cultural Resources Committee and Project for Health Policy Methods, August 2025. Group members include Julie Cross, Mallory McEwen, Derek Moss, Patricia Pamutin, and Emily Starton. Next slide. With gratitude to the rural providers, school staff, Indigenous leaders, and grassroots organizers who show up every day to ensure students have what they need with dignity and without barriers. Next slide. So, what exactly is period poverty? Well, in 2019, the American Medical Women's Association defined period poverty as the inadequate access to menstrual hygiene tools and educations, including but not limited to sanitary products, washing facilities, and waste management. Next slide. Throughout our research and review of the literature, we were able to understand several things about adolescents in America who experience period poverty. Current estimates suggest that 20% of teenage adolescents experience period poverty, with 29% of those students missing school due to a lack of supplies. As you can imagine, children in poor and rural communities are at greater risk. Due to geographic and transportational barriers, children in rural communities are at greater risk of experiencing more profound period poverty and its associated negative outcomes. Unfortunately, to date, Montana has no legislation addressing period poverty. In 2023, State Representative Emma Kerr Carpenter, representing the 46th House District, introduced HB 498, Menstrual Equity for All Act, to try and address this issue. Unfortunately, it was tabled in committee and was never passed into law. As it stands today, 28 states currently legislate around this issue. However, Montana is not one of them. Next slide. Montana is very rural and does not fund period products despite national research showing the need. As you can see in the visual provided by the Alliance for Period Supplies, Montana still remains in that group noticed in gray as states who currently have no requirement or funding for period products in schools. According to the Montana State University Research Center, rural areas often lack resources that are available in more densely populated areas of the state. Next slide. As a result of our research and review of the current literature regarding period poverty in America, along with my own personal experience as a rural family physician, our group has decided to highlight the gap in menstrual product access for rural Montana students in grades 5 through 12. This gap has measurable impacts on the well-being and educational participation of menstruating youth. Our target audience is the Montana Senate Education and Cultural Resources Committee in the legislature of the state of Montana. Our goal is to increase an understanding and begin robust support for legislation that would require all grade 5 through 12 schools in the state of Montana to provide free and accessible menstrual products to their students.
I'll begin to describe the context within our project. Let me first begin with the economical points. As Julie mentioned, since 2019, there's been a sharp increase of the costs associated with the inflation of sanitary products. The cost of consumers' prices for both tampons and pads have soared. Sanitary pads rose more than 41% since 2019. However, in contrast, consumer purchases for such supplies decreased between 12 and 16%. Another context is the social access, which there is a lack of access to period products not being available in rural Montana towns. Menstruation is still not widely or openly acknowledged within schools as a norm, no schools giving access to any products. The environmental and geographical barriers are stark as Montana is a rural state. Due to the majority of the state being in rural areas, there's limited access involving transportation and commuting. There's several urban cities in Montana, but where bulk prices in places such as Costco or Walmart could be reduced, but the reality for many aged 5th through 12th graders is that an hour or more of driving can be the cost of them being able to access the supplies or not. In small communities that have just a mom and pop store, the prices may be even more increased associated with transportation of the supplies. Additionally, as mentioned by Julie, the political aspect is that in Montana, despite many other states having legislation, Montana does not currently have any type of legislation that addresses period poverty in schools or providing products for students 5th through 12th grade. Next slide. So as we mentioned, there's not currently free access in Montana to menstruation products. This can lead to a risk of high and poor outcomes for students that may need access. We mentioned the social, environmental, and economical and political issues for all of these. You can see here on our diagram the complex issues where navigation can be exorbitantly difficult for students and create a number of poor outcomes if they do not gain access or the state chooses to continue not to provide legislation. Next slide. After refining our issue multiple times, our project came to the immediate problem that there is too little access to period products in rural Montana for 5th through 12th graders at or below the federal poverty level. Next slide. We decided that where we needed to start was the status quo. Our current baseline is that there is limited access to resources for 5th through 12th graders, as most of the state resides in rural communities where the prices are not attainable for students, or they may have limited education of menstruation and menstrual hygiene products. So there's really no resources currently with the static quo. We did come about 4 various alternatives that Derek will go on to describe. I'll just give you a quick highlight here. Alternative 1, menstrual supplies should be available in all public schools with education in health classes. Alternative 2, subsidized access programming through health centers for recipients of Medicaid. Alternative 3, supplies and info through families receiving grants, SNAP, or Mothers on WIC could obtain period supplies. Or alternative 4, subsidized mail order supplies and government maintained educational website.
All right, so I'm going to jump right in here. And like Emily was talking about, with the status quo, right now there's a lack of availability, a lack of appropriate variety. It's cost prohibitive, and there's a lack of education on properly ways to access these devices as well as how to use them. And so these are typically seen as a women's health issue rather than a public health and equity issue. And so as we look to address this problem, we came up with 4 possible alternatives. So we'll go ahead and move on to the first one. And that is providing these menstrual products in the public school system. If we disperse these through health classes using school nurses and educators, most of these children, these kids are able to access them there. Most people access the school system in some form. And this increases that equity and that availability. Funding would need to come from education or health and human service agencies. So we'd have to address that at some level in order for this to be a viable option. But if we move on to alternative 2, what we're looking at here is if we subsidize the access through health centers for recipients of Medicaid. If we do this, it's dispersed in these local health centers to these Medicaid recipients. And this is a trusted and safe point of access within our communities. And they're targeted to the demographic we really want to affect, and that's our low income members. It's sustainable because it's integrated with some of these Medicaid programs. But one of the things that's going to need to be addressed is who's going to bear the cost, if it's the health centers, insurers, or some of the other agencies we talked about a minute ago. Moving on to the third alternative, we suggesting that these supplies and info are available through families receiving TANF grants, SNAP, and mothers who are on WIC. And the reason for this is the specific demographic that we're targeting. It adds that equity component to it, as well as it's sustainable because these are means tested programs. But again, as some of these other alternatives addressed, something that needs to be further evaluated would be where that brunt of that cost is going to come from. And lastly, if we move to the fourth alternative, is that subsidized mail order supplies and government maintained educational website. Using the Postal Service, this further enhances that equity component, especially in rural areas where they might not be close to the health center. Maybe more homeschooling takes place, things of that nature. So a little bit more equitable. However, there might be more costs associated with this as they move forward and vet this out as a viable alternative. So those are our 4 policy alternatives. We'll go ahead and pass it over to Mallory.
Awesome. Thanks so much, Derek. So next in our presentation, we're going to talk through our criteria, the possible outcomes of given interventions, and then the trade-offs that we're keeping in mind. Perfect. So the criteria that we wanted to use to size up our different policy options included effectiveness, equity, access, and operational sustainability. And we used these criteria kind of like the scorecard to determine which ideas actually hold water. Next slide. Perfect. So our first criteria is effectiveness, and effectiveness is about whether the policy actually does what it's supposed to, which in this case is making sure that students and folks aren't going without the period products that they need, and in turn, hopefully cutting down on things like missed school, experiences of stress, and other mental health challenges. There are different ways we can evaluate effectiveness. One option is to track rates of absenteeism before and after a policy goes into effect. We could also use standardized tools like the PHQ-9 for depression or the GAD-7 for anxiety to see if stress or mental health outcomes change, and specifically for those students who might be affected by period poverty. We could also survey students to see if they feel like they're more able to engage in day-to-day life, including school, while on their period. Effectiveness really matters because if the policy doesn't work, then what's the point? We want to make sure that we're assessing effectiveness and ensuring that we're being good stewards of whatever resources this policy intervention requires. Next slide. So our second criteria is equity, and as we know, equity doesn't necessarily equate with fairness. Our goal isn't to give everyone the same thing, but to make sure that the people who face the biggest barriers actually get what they need. And that matters because as we were exploring and researching this topic, we came to realize that period poverty doesn't impact everyone equally. So to measure equity, we'd look at whether resources are reaching groups that typically get left behind, like low-income students or students in rural districts. That could look like tracking the percentage of supplies that are distributed to Title I schools or rural zip codes. And of course, on the qualitative side, we'd want to hear directly from students about whether they feel more supported in accessing the supplies that they need. This is really important because if a policy doesn't address disparities, it risks reinforcing them. And that's the opposite of what we want. Next slide. So access is the practical side. Can people actually get the products that they need? That means that products are affordable, appropriate, and easy to obtain without having to jump through a bunch of hoops. We'd measure access by surveying students about whether costs or logistics of accessing these supplies still get in the way. Another way to measure access would be to monitor the percentage of students that know where to get supplies and feel confident using them. This matters because even if supplies exist, if they're too hard to obtain, whatever interventions or policies we implement won't solve the problem. Next slide. All right, our last one is sustainability, and this is about making sure that our policy is able to last over time. So it's not just about money and financial sustainability, but also about whether schools can realistically implement or handle this policy intervention. Um, we can measure this by tracking how many years of funding are guaranteed, the average cost per student per year, and whether staff feel like this program is sustainable from their perspective. So we would want to make sure we're engaging with stakeholders and obtaining feedback whenever we can. And we want to make sure we're measuring sustainability so that whatever intervention we implement, it won't just fizzle out. Next. Perfect. We're going to pass it off to Pat to talk through trade-offs.
Oh, I believe this is actually Derek's slide. If you could go ahead and
Oh,
put the baton there.
Sure.
oh,
No
sorry,
problem.
Derek.
You're good. So once we've looked through the policy alternatives and we've gone through these evaluation criteria, we still need to confront the trade-offs and take a look at make sure it's worth it. And so we've identified 5 potential trade-offs that need to be addressed. First is money, and that's, does the extra expense to the schools and the government outweigh the benefit of increased access to menstruators in rural Montana? Next one is time. Does the extra time involved in ordering, delivering, implementing, and enforcing the alternative outweigh the benefits of increased and more equitable access to menstrual products? The third, process building for implementation. Is the building of the implementation structure for the alternative too burdensome to be worth it? Fourth, supportive education planning. Is the requirement for extra educational services too burdensome for the success of the alternative? And lastly, additional requirements for underfunded public schools. Is the extra financial demand of the alternative to already financially underfunded agencies too great compared to the increased accessibility of menstrual products to the target population? And so after we've evaluated all this, we've come up with a recommendation. So we're going to go ahead and pass it on over to Pat.
So this is our outcome matrix. Don't be alarmed. There's a lot of colors. It does function on a stoplight system. So the boxes that are green, that means generally it's a favorable point for the alternative. And if it's red, closer to red, then that means it's poor. So I don't want to belabor the point, but I do want to note that in our status quo, across the board for all of our criteria, effectiveness, equity, access, and operational sustainability, it's very poor. Essentially, supplies are not accessible, and this leads to negative health outcomes, and there is very little infrastructure to sustain anything. And so if you look at our alternatives, one thing I want to highlight is that in terms of effectiveness, we wanted to suggest alternatives that would ideally get more supplies to more youth. So we tried to combine it with existing infrastructure. In alternative 1, we combined it with schools. In alternative 2, it's with health centers. In alternative 3, it's social services programs and centers. And in alternative 4, we combined it with the existing postal service infrastructure. Now, where we do get the most variety is in terms of equity, access, and operational sustainability. When it comes to equity, one thing that we were concerned about with alternative 1 is that because the access is through schools, what happens when families are not connected to schools, when someone is homeschooled or during summer break? So we're concerned about access being limited during those times. Additionally, in terms of operational sustainability, we're also looking at maybe diverting the funding from either the Department of Education or other health funding. In alternative two, we assess that it's a little bit worse in terms of equity and access because the focus is on access through health centers. And in rural communities, health centers can sometimes be underfunded or hard to come by. And you might just have like the very basics in terms of clinics, or your health center might be 2 towns and like an hour away. And we also were in terms of operational sustainability, like Derek mentioned, there's a question of cost. We are looking at, is the health center, if it's small, going to bear this cost, or is it going to come from insurers? When we're looking at alternative three, we thought that it was similar to alternative two in terms of equity and access, and that it's a little bit better than the status quo, but still relatively poor. And that's because sometimes, these families may not be able to have access to social service programs, informations, and centers. And when it comes to operational sustainability, there is also a question of whether or not programs that are more welfare oriented are going to be well received, and if welfare programs, which are already kind of tight on funds, can bear the cost of such a thing. Lastly, for alternative number four, we did note that this would likely be better in terms of equity. If the barrier is low for getting supplies, then more people can access it without any questions, without jumping through hoops. But we noted that this is probably the poorest in terms of operational sustainability because it would be the most expensive. People would be getting things mailed out. So there's those like costs of postage and infrastructure for getting those things mailed out, for keeping up the websites, etc. So in the next slide, we just wanted to remove all the words and highlight to you that alternative one is ultimately what our team is going to recommend. And this kind of came down to operational sustainability and access through schools. We thought that because this alternative was linked to schools, that it would have the broadest reach and the most sustainable reach because it would be connected to both the Department of Health and the Department of Education. And here's our recommendation slide with the benefits and risks. For effectiveness, we noted that it's great that it is a focused intervention with appropriate supports for youth. And it's accessible for different socioeconomic groups because kids have to go to public school. In terms of access, there's a public school community and like a greater geographic reach for those who are attending school. And again, operational sustainability, you've got multiple potential sources of funding. In terms of risks, for effectiveness, there was some concern about the appropriate health expertise within schools and the capacity for teachers and nurses within the school to provide these supplies and education. And in terms of equity and access, again, there was concerns about not being able to reach those outside of the public school system. And lastly, for operational sustainability, we were concerned about schools being underfunded and then a lack of community resources surrounding the schools. And so that is our presentation. We hope that you've learned something about period poverty and some of the issues that make it complex. And we hope that it highlights this for you as a public health issue as opposed to just a women's issue, and that it is very important to multiple members of the community. And here are some lovely photos to send you off with, and then our resources and references.